We are in the simulation room, one of the teaching room at the Hamilton General Hospital, and a trauma program and intensive care unit program too. It's one of the tools that we use for education. This room is being used for learners running trauma case scenarios or other acute medical emergency scenarios. So we try to replicate what's happening in real life. We can have different scenarios. We can have the vital signs. We can play with that up and down. We can get the heart rate high. We can get the blood pressure down. Have a sound, so for example, for respiration, you can increase the respiratory rate. You can decrease it. You can make sounds and, like patient has an upper airway obstruction to make it similar what we may face in the real life. We can give you a scenario like a pedestrian hit by a car. We can give a scenario about a patient had a bleeding in the chest, or if they had a head trauma scenarios, we can give a hemorrhagic shock scenario and see the intervention and how the learner can recognize the life-threatening injuries. We get them exposed to different scenarios that can be presented in our emergency room. It's a quite systematic approach to avoid missing any injuries. We start what we call A, B, C, D. E, A for airway protection. So the first thing is that you look for the airway so the patient can breathe on his own, or he needs some sort of assessment. So given a high oxygen at the very beginning and to improve his oxygenation to the vital organs in the body, including the brain, heart, lungs. And so this is the first step, is that when we do our trauma assessment is we look for the airway. While we're doing the airway, we also maintain the neck and make sure there's no underlying neck injuries. Then after that, we move down to B, which stands for breathing. So we look for any life-threatening injury in the chest. And then we move to C, which is circulation. We measure his vital signs. And the other thing we can initiate in the same time, IV accesses, we give him fluid. And then we move to D, where we see any deformity that are obvious. And then after that, we go to E, where it's complete exposure of the body, and examine for any hidden injuries. One of the training in the simulation room is how to build up an effective team, where we have a coordination. You had a trauma team leader, and then you had other 3 members that can coordinate and work in harmony, and there would be a leader that can orchestrate that. This is one of the really key points in trainings, is how to have a very effective team working together and communicating in a good, proper manner. At the end of the simulation, we can have a debriefing where the learners and coaches, they meet and they had a feedback, some positive feedback for improvement and adjustment for the next case scenario or the training.